Hello, my name is Jenna Lavity. This is a slideshow on the topic, is it ethical to use cow-based infant formula in NICUs across America and across the world for that much? I chose this topic because I have a personal connection to it. My daughter received injuries due to cow-based infant formula while in the NICU. There is a trigger warning associated with this. There will be images and real-life situations included within. Viewer discretion is advised. Throughout the slideshow, I will introduce topics, show evidence, and give the arguments on why I feel cow-based infant formula has no place in a NICU. Some of you might be asking, what is a NICU? A NICU is the neonatal intensive care unit, where babies who were just born, maybe a little bit below weight, or even a little bit too early, go to receive specialized care. The type of staff you would typically see is specialized doctors, nurses, and support staff, like respiratory therapists, occupational therapists, and physical therapists. The type of illnesses seen in the NICU are low birth weight, genetic disorders, and respiratory distress, just to name a few. One of the big illnesses seen in the NICU is something called NEC, or necrotizing enterocolitis. For the purpose of this slideshow, we are going to focus heavily on necrotizing enterocolitis. Necrotizing enterocolitis is a distinct progressive disease characterized by its mortality rate. Doctors, nurses, and support staff are trained to watch and monitor for some very specific signs and symptoms of necrotizing enterocolitis. They are going to include GI symptoms as well as systematic symptoms. I'm going to warn you that on the next several slides, again, are real-life patient cases. We did receive patient consent to share this story and images. For context, here's a little bit of patient history. This is a female patient born at 36 weeks via C-section who had routine, regular, uncomplicated prenatal care. Mother was a G2, P2. VBAC was not an option as this pregnancy occurred prior to the 18-month mark most OBs will require to attempt a VBAC. APGAR scores were good. After 18 hours of life, baby was moved to a NICU as it was found to be jaundice. It needed some bilirubin lights to help it. During its stay in the NICU, it was incorrectly fed cow-based infant formula. A short time after, baby presented with abdominal distension and respiratory distress. Mom alerted the doctor to these findings. Additional testing was done, and a diagnosis of NEC was given. Shortly after, baby was transferred to a higher level NICU of care within the same city. Support services at this time included an OG tube and respiratory services. Now that we have an understanding of what NEC is and some of its signs and symptoms, we need to start asking ourselves some very important questions. The first being, what are some common nutritional issues in NICU patients? Failure to suck effectively, GI tract issues like immaturity and not able to tolerate feedings, aspiration, allergies, and intolerance to certain ingredients, among other things. Necrotizing enterocolitis are part of those other things. They primarily impact premature babies. Necrotizing enterocolitis causes things like swelling all the way up to death. Another question we want to ask ourselves is, what is the ethical part of offering cow-based formula in NICUs? Doctors, nurses, and support staff are trained to know the difference between right and wrong. Doctors take a Hippocratic oath claiming to do no harm. So then we have to ask ourselves, if we know that a product has a direct connection to harming the world's most sensitive patients, do we keep using that product? NEC has been known for at least 35 years. In 1990, in the Lancet peer-to-peer review journal, an article was published correlating the direct link between cow-based infant formula and an increase in NEC patients within the NICUs. So if we were to remove all the cow-based formulas from the NICUs, then what do we feed these babies? Alternative infant formulas that are soy-based, plant-based, and sometimes goat-based are available. But as literature and the pediatric journals suggest, breast is best. But what if mom can't produce enough breast milk or any breast milk? That's where donated breast milk comes in. And there are many companies across America offering donated breast milk. A specific company called Milk Banking Association of North America helps to advocate, improve access, screen donors, test the donor milk, store and ship donor milk across America. You might be thinking, well, if that's the case, what's the problem? The problem is cost. Average American households spend between $1,500 to $2,500 annually on infant formula, compared to $3 to $5 per ounce for donated milk. So then what are our options? Many states offer discount programs, WIC, and even some insurances will cover the cost of donated breast milk. Let's talk a little bit about some of the short-term impacts that necrotizing enterocolitis has. We could see things such as intestinal perforation, sepsis, peritonitis, and even death. And unfortunately, for a lot of these babies, death is the result of necrotizing enterocolitis. For those babies who do survive necrotizing enterocolitis, there will be lifelong complications associated with NEC. They include things like intestinal strictures, short bowel syndrome, growth failure, neurological development impairments, respiratory problems, GI complications, and nutritional complications. So let's get back to our case study. As you can recall, patient had been transferred to a higher level of NICU care within the same city, where she received 8 consecutive weeks of continued antibiotic therapy. This was thought to cure the necrotizing enterocolitis. Unfortunately, at 10 months old, patient presented to the emergency department for abdominal distension, respiratory distress, and failure to hold feeds. After some testing, it was concluded that a full bowel rupture had occurred. This preceded a 6-hour surgery, laparoscopic surgery, to try to find the cause of perforation. Unfortunately, after the 6-hour procedure, no such cause was found, and the patient needed to be cooled and rest from surgery. A week later, a second surgery was performed, where it was found lower in the colon that intestinal strictures was the cause of the full bowel rupture. Due to the severity of trauma to the body, the patient remained sedated and intubated for the following 8 weeks. She also received continued IV antibiotics because she was septic. The intubation and sedation allowed the baby's body to resume a more normal hemostasis form. After baby was successfully extubated, the patient received occupational therapy, physical therapy, cardiac monitoring, and another 8 weeks of continued antibiotic therapy. Unfortunately, baby was discharged with a colostomy bag. Luckily, within 10 months of that discharge, baby reached weight appropriate for the colostomy takedown surgery, which happened to be an outpatient surgery. Baby was able to return home the same day. You might be asking, were there lifelong injuries associated with this necrotizing enterocolitis diagnosis? And the answer to that question is yes, there are. This patient, due to the length of antibiotic use, will require lifelong dental care for damaged and brittle teeth. This patient also requires routine cardiac monitoring. One of the complications of sepsis is a weakening to the heart. This weakening occurred in 2 of the main heart valves, causing something called regurgitation, where the blood flow is regurgitated and not processed all the way through the heart, resulting in dead red blood cells. The most important part of this case study that I want you to take away is she survived, where most don't. She is currently part of a class action lawsuit holding Infamil and Similac manufacturers accountable for not giving proper notice of the correlation of infant-based cow formula and the correlation of NEC. So in conclusion, in a world where patients are put above profits, where doctors do the right thing and support staff and hospitals do right by their patients, we would like to see all cow-based infant formula removed from the shelves. We would also like to see all cow-based infant formula have warning labels on the cans and containers of infant milk, similar to that on cigarettes, warning potential consumers of the dangers of this product. And donated breast milk would be the gold standard in all NICUs and nurseries across America. Thank you for your time and attention on this very important and near and dear to my heart topic.